Which of the following is the normal adult reference range for blood calcium levels? A. 9.5 to 11.0 mg per deciliter. B. 8.0 to 9.5 mg per deciliter. C. 9.0 to 10.5 mg per deciliter. D. 8.5 to 10.0 mg per deciliter. The answer is C. 9.0 to 10.5 mg per deciliter. The normal adult reference range for blood calcium levels is 9.0 to 10.5 mg per deciliter. What is the normal reference range for an adult male hematocrit? A. 40% to 50%. B. 42% to 52%. C. 45% to 55%. D. 47% to 57%. The answer is B. 42% to 52%. An adult male hematocrit is considered normal when between 42% to 52%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. What is considered the normal reference range for an adult female hematocrit? A. 39% to 49%. B. 35% to 45%. C. 34% to 44%. D. 37% to 47%. The answer is D. 37% to 47%. The normal reference range for an adult female hematocrit is 37% to 47%. Anything below this may indicate anemia, elevated white blood cell count, or blood loss, while numbers above this may indicate dehydration, chronic oxygen deficiency, or a condition of excess red blood cell production, such as polycythemia vera. A 67-year-old male presents to your clinic with a blood pressure of 129/82 mm of mercury, temperature is 98.9 degree Fahrenheit, and heart rate is 82 beats per minute. Blood work shows a cholesterol level of 162 mg per deciliter, fasting blood glucose of 98 mg per deciliter, and WBC count of 9,000 cells per microliters. His history is significant for street segment elevation myocardial infarction, STEMI, 7 years prior. What, if anything, would you counsel him regarding his vitals and blood work? A. His cholesterol is too high. B. His heart rate is elevated. C. Fasting blood glucose is too high. D. WBC count is elevated. The answer is A. His cholesterol is too high. All of his vitals and blood work are within normal range except his cholesterol. Normally, cholesterol is considered within normal range if it is under 200 mg per deciliter, but in the case of patients with past history of cardiac event or stroke, cholesterol should be maintained at under 150 mg per deciliter. Which of the following is considered the normal range for platelet count on a complete blood count, CBC? A. 100,000 to 400,000 cells per microliter. B. 200,000 to 500,000 cells per microliter. C. 150,000 to 400,000 cells per microliter. D. 150,000 to 450,000 cell cell. The answer is C. 150,000 to 400,000 cells per microliter. The normal range for a platelet count on a CBC is 150,000 to 400,000 cells per microliter. Numbers below 150,000 cells per microliter may result in poor clotting ability, while numbers above 400,000 per microliter may increase risk of stroke or thrombosis. Which of the following values would be considered a normal erythrocyte sedimentation rate, ESR? A. 18 mm per hour. B. 34 mm per hour. C. 72 mm per hour. D. 45 mm per hour. The answer is A. 18 mm per hour. A normal erythrocyte sedimentation rate should be below 20 mm per hour. Anything above this indicates some sort of inflammatory process. Which of the following is considered the normal range for specific gravity on urinalysis? A. 1.015 to 1.035. B. 1.010 to 1.030. C. 1.001 to 1.020. D. 1.005 to 1.025. The answer is D. 1.005 to 1.025. While adults may have a specific gravity that ranges anywhere from 1.000 to 1.030, the normal reference range is generally considered to be 1.005 to 1.025. A specific gravity below 1.005 could indicate very dilute urine. The specific gravity of water is 1.000, and anything higher than 1.030 may be present in the case of dehydration, kidney disease, infection, or glucose in the urine. Blood pH is maintained by the body in a very close range. What is the normal range for pH of the blood? A. 7.35 to 7.45. B. 7.37 to 4.47. C. 7.32 to 7.42. D. 7.34 to 7.44. The answer is A. 7.35 to 7.45. The normal range for pH of blood is 7.35 to 7.45. Anything below that range is considered to be acidosis, while values above that range would be considered alkalosis. Recall that the main blood buffer system involves carbonic acid, bicarbonate, and carbon dioxide. Which of the following is not determined by urinalysis? A. Specific gravity. B. Presence of blood. C. pH. D. Presence of bacteria. E. All of these are determined by urinalysis. The answer is E. All of these are determined by urinalysis. A urinalysis can be an important tool in diagnosis conditions such as the presence of kidney stones, urinary tract infection, and even dehydration. A typical urinalysis will contain information on all of the parameters indicated. The presence of glucose, ketones, crystals, casts, and leukocyte esterase may also be included. Washed red blood cells are generally administered to which of the following patient populations? A. Patients with metastatic disease. B. Patients who are immunocompromised. C. Patients with a history of allergic reactions to transfusions. D. Patients with chronic kidney disease. The answer is C. Patients with a history of allergic reactions to transfusions. Washed red blood cells are generally prepared for patients with a history of severe allergic reaction to blood transfusion. Washed red blood cells are not generally required in patients with kidney disease, patients who are immunocompromised, or patients with metastatic disease. Before administration, all plasma products must be tested for which of the following? A. ABO compatibility. B. RH compatibility and ABO compatibility. C. RH compatibility. D. None of these are correct. The answer is B. RH compatibility and ABO compatibility. Before administration, plasma products must be checked for ABO compatibility and RH compatibility. ABO blood type does not have to be an exact match, but blood types must be compatible. An RH positive individual, for example, is compatible with either RH negative blood or positive blood, while an RH negative individual is only compatible with RH negative blood. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. Where would the nurse listen to evaluate the pulmonic valve? A. The second left intercostal space. B. The first left intercostal space. C. The first right intercostal space. D. The second right intercostal space. The answer is A. The second left intercostal space. The pulmonic valve can be auscultated to the left of the sternum at the second intercostal space. Auscultation at this space can aid in the identification of pulmonary murmurs such as pulmonary stenosis or regurgitation. The second right intercostal space is the location at which the nurse would be able to evaluate the aortic valve. The first intercostal space is not generally auscultated in a normal heart exam. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. The nurse pauses to listen at the fifth intercostal space on the left midclavicular line. The nurse is evaluating which of the following? A. The mitral valve. B. The pulmonic valve. C. The tricuspid valve. D. The aortic valve. The answer is A. The mitral valve. The fifth intercostal space on the left midclavicular line is the best location from which to evaluate the mitral valve. The other heart structures are paired with locations as follows. Aortic valve, the second intercostal space right of the sternum. Pulmonic valve, the second intercostal space left of the sternum. Tricuspid valve, the fourth intercostal space left of the sternum. A nurse administers 1 unit of packed red blood cells. 4 to 6 hours later, what change can be expected in the patient's hemoglobin levels? A. 5% decrease. B. 3% increase. C. 20% increase. D. 15% increase. The answer is B. 3% increase. A nurse should expect to see an approximately 3% increase in the recipient's hemoglobin 4 to 6 hours after the administration of 1 unit of packed red blood cells. Which of the following has been removed from washed red blood cells? A. Plasma. B. Antibodies. C. Platelets. D. All of these are correct. The answer is D. All of these are correct. Washed red blood cells are the product of blood that has been stripped of plasma, leukocytes, antibodies, cytokines, and platelets, in addition to any other blood proteins. After thawing, fresh frozen plasma must be used within which of the following time frames? A. Within 12 hours, if refrigerated. B. Within 24 hours, if refrigerated. C. Within 30 minutes, refrigeration is not advised. D. Within 2 hours, if refrigerated. The answer is B. Within 24 hours, if refrigerated. Whenever possible, fresh frozen plasma should be transfused immediately, or as soon as possible, after thawing. However, if this is not possible, it may be refrigerated for as long as 24 hours after thawing. Which of the following laboratory values is not reported in a basic metabolic profile, BMP? A. Sodium. B. Blood urea nitrogen, BUN. C. Phosphorus. D. Creatinine. E. Potassium. The answer is C. Phosphorus. A BMP is a commonly ordered lab value set on patients. It checks commonly reported electrolytes in the body. It is also known as a Chem7. It looks at sodium, potassium, carbon dioxide, bicarbonate, blood urea nitrogen, BUN, creatinine, and glucose. Phosphorus is not included in this laboratory order, and must be checked separately. A nurse is reviewing labs for a 68-year-old female. Lipid testing revealed a total cholesterol of 230 mg per deciliter. This patient's cholesterol level would be defined as dash. A. Normal. B. Low risk. C. Moderate risk. D. High risk. The answer is C. Moderate risk. A total cholesterol over 200 mg per deciliter is considered a risk factor for cardiovascular disease. A total cholesterol level of 200 to 240 mg per deciliter is considered moderate risk, while a total cholesterol of over 240 mg per deciliter is considered a high risk for cardiovascular disease. This patient's total cholesterol is 230 mg per deciliter, which would place her in the moderate risk category. Which of the following might be a sign of a transfusion reaction? A. Pallor or cyanosis. B. Urticaria, itching, or swelling. C. Myalgia, tingling, or numbness. D. All of these are correct. The answer is D. All of these are correct. Common signs of transfusion reaction include urticaria, itching, or swelling, pallor or cyanosis, anxiety, and myalgia, tingling, or numbness, in addition to diaphoresis, tachycardia, headache, and gastrointestinal distress. Droplet precautions are designed to stop the spread of infectious diseases that travel through droplets. These droplets may land on the mucosa of the nose or mouth after a host sneezes or coughs. Which of the following conditions does not require the use of droplet precautions? A. Influenza. B. Varicella. C. Rubella. D. Mumps. E. Pertussis. The answer is B. Varicella. Varicella requires airborne precautions. Staff caring for patients with varicella should be immune. One's immunity to varicella can be confirmed by a blood test. Standard precautions are a set of guidelines that are designed to prevent the spread of infection by exposure to an individual or their bodily fluids. Which of the following is not considered a standard precaution? A. The use of alcohol-based gel after patient contact. B. The use of gloves when placing a peripheral intravenous line. C. The availability of appropriate and cleanly resuscitation equipment. D. Placing clients in private rooms. E. Disposal of used linens in designated areas. The answer is D. Placing clients in private rooms. Standard precautions should be utilized in the care of every patient. Hand hygiene before and after patient contact is always required. Clean, functioning equipment should always be available. The use of personal protective gear when there is potential to blood or bodily fluid exposure is critical. This includes the proper disposal of soiled materials such as linens. However, it is not necessary for patients to be housed in private rooms unless they are affected by an infectious disease. If private rooms for infectious individuals are unavailable, it is acceptable to place patients in cohorts of the same infectious disease. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of people. B. Areas with lots of needles. C. Enclosed areas. D. Wide open spaces. The answer is D. Wide open spaces. A patient with agoraphobia has a fear of wide open spaces. A 4-year-old child is admitted to the hospital after his family was in a car crash, where his parents died. The child keeps asking you to bring his parents back to life. The nurse knows that. A. The child is delusional and may have suffered a concussion as a result of the crash. B. The child has not seen a person die before. C. The child is depressed. D. This is a normal reaction. The answer is D. This is a normal reaction. This is a normal reaction for a young child, who may not fully understand death. These requests are not necessarily indicative of delusion or depression. When reviewing a client's chart, the nurse sees that the doctor identified that the client is experiencing a situational crisis. An event that could cause this is A. Retirement. B. Child abuse. C. Rape. D. Abortion. The answer is D. Abortion. Abortion is a common cause of a situational crisis. Retirement may cause a maturation crisis, and child abuse and rape may cause an adventitious crisis. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of needles. B. Areas with exposed levels, such as balconies. C. Wide open spaces. D. Enclosed areas. The answer is B. Areas with exposed levels, such as balconies. A patient with agoraphobia has a fear of heights, thus exposure to exposed levels or other significant drop-offs will scare the patient.